My name is Kelly Berry, and for those of you that don't know me, I'm the Executive Director for the Central Valley and Kern County Division with the American Heart Association Western States. As you may know, the American Heart Association and Anthem have joined forces with the goal of reducing cardiovascular disease, stroke, and diabetes in our community. Today, we're going to hear from a few experts about how we can work together in improving our heart health within the Central Valley. Juliet Martinez, our AHA Senior Corporate Initiatives Director with the Heart Association, will be our moderator for our discussion today. And then joining Juliet on the panel are Selena Escobar, who is a Program Director of Special Programs within Anthem Blue Cross, Valet Lee, who is the HCNYC Secretary of the Hmong Cultural Center. And then we have Dr. Lin, who is a cardiologist with UCSF Fresno, as well as an AHA board member. And Kimberly Murphy, who is a health education assistant with the Black Infant Health Program at West Fresno Regional Center. And then lastly, of course, we have Dee Sanchez, who is a licensed marriage and family therapist and an owner of Fit Therapy. After our panel discussion that we have today, we will have a question and answer session, as well as some great resources for you to all use. So let's get started, and I am going to kick it over to Juliet.
Thank you, Kelly, so much, and welcome to everybody today. We're so excited to be working together to helping building healthier communities in the Greater Central Valley. And before we get started, I have one housekeeping item. Again, if you have any questions for speakers as we go through the program, please enter them in the chat box, as we will be holding those until the end of the discussion. And just to kind of gauge where our audience is, we're going to just do a quick poll, and we're going to be asking a question about which social determinant of health topic do we need most urgently to address in our community. So if you could go ahead and just take a quick look at some of the choices, including access to healthcare, transportation, safe neighborhoods, accessible and healthy foods, education, housing, and access to employment. So if, again, our audience could just go ahead and take a moment there to share what you think we should be addressing most urgently in our community would be fantastic. And one also having your insight to allow us to do is make sure that we're pulling together resources from the perspective of the communities that we're a part of, and also being able to learn and listen and continue to support heart health wherever we are, whether it's at work, at home, or just out having fun a day at the park. Okay, I'm going to go ahead and give everyone 10 more seconds to wrap this up. Okay, let's see where everybody's at. Thank you for everyone that answered. So it looks like accessible and healthy foods is coming in with 31, or almost 1/3 of respondents looking at that, and then access to housing, access to healthcare, transportation, and safe neighborhoods have also come in, as well as education. So again, thank you for answering that poll. It just helps us better understand what the needs are from your perspective. Okay, so with no further ado, we're going to go ahead and jump right into our panel discussion. And again, if you have questions, please go ahead and ask them in the chat box. So Dee, the very first question is for you. Can you please share with us what are the social determinants of health, especially for those who may be getting familiar with them for the first time in this forum?
Thank you, Juliet. I'm going to first start by giving you the definition that the Center for Disease Control establishes, because I think it's important, if you Google it, that you have an understanding about what you are receiving on the other end. According to the CDC, it states that those factors that impact upon health and well-being and the circumstances in which we are born and grow up in, live in, work in, age in, including health systems. And so when we think about this, we need to think about the conditions in which we live in and the conditions that most people are impacted by. And so more times than not, social determinants of health are not distributed equally in some places. as it pertains to rural environments, as it pertains to people of color, and as it pertains to underserved or underserved communities. And so we have to look at those things first and foremost. I want to submit to you that there's disparities and inequities, and those are two different things. Disparities are judged by maybe gender, race, ethnicities, things like that. And inequities means it's a system problem. Maybe there's a power or policy or procedure that is not in place either at a local, national, or global level that are keeping people from having the proper access to healthcare, education, food, as we just talked about, shelter, and all sorts of other things that impact our overall health. As a therapist, I have to look at the social determinants of mental health, and that cannot be without talking about trauma, or the ACEs, adverse childhood experiences that people live by and actually dictate a lot of their value system, their belief system, and their overall mental health. So I'm going to share with you really quickly so you have an idea about what that could look like when you talk about someone who does not have proper access to care and how it affects them not only socially, but relationally or academically or in their employment. I'm borrowing this information from Dr. Shim from UC Davis. So Jason goes to the hospital. So then the question is, why is Jason in the hospital? And then the answer would be because he has a bad infection in his leg. But why does he have a bad infection in his leg? He has a cut on his leg and it got infected. But why does he have a cut on his leg? He was playing in a junkyard next to the apartment building and fell on some sharp glass that jagged and cut his leg. But why was he playing in the junkyard? Because his neighborhood is run down. His kids play there and there's no one to supervise them. But why does he live in that neighborhood? His parents can't afford a nicer place to live. But why can't his parents afford a nicer place to live? His dad is unemployed and his mom is sick. But why is his dad unemployed? Because he doesn't have much education and he can't find a job. But why? And so I want to leave you with that, because you see, it's not because Jason has a cut on his leg. It's because his environment that he lives in is dictating his health and his safety and the supervision of his children, which is why he got cut. And so when we look at the iceberg of social determinants for health or mental health, we can't just solely stay at the top, which is Jason was at the hospital. We have to dig deeper, which says he's in an environment that doesn't have access to proper education, that doesn't have proper access to employment, and doesn't have proper access to healthcare. So when we think about social determinants, I want us to think not at the tip of the iceberg. I want us to really hone down and see where disparities and inequities are there and how that plays on our overall health. Thank you. Dr. Lynn, if you can fill us in about how that impacts us from a health perspective, that'd be great. Thank you.
Thanks, Dee. That was really great. Yeah, absolutely. I think these kind of social determinants of health, right? Like where you're living, your environment, your family, like who's in their community, that's going to absolutely affect our health. Kind of with that example that you used. I mean, I think, most pressing, I think whenever we're growing up, no matter where we are, right, we're kind of focusing on the immediate things. So, what is, mom and dad doing? What are my siblings doing? What's immediately out there? So if you're in an environment where it's not a very safe neighborhood, or you don't perhaps have, as much, access to nice playgrounds or, all of these things, then where you're playing, like that example you had, right, you're going to be at much more risk of certain things. You make do with what you're able to do and what you have access to. For children, right, they're going to try to play wherever they can. They're children, they want to run around, they want to do things. And so, versus if it was at a nice playground where someone is able to supervise and there's some perhaps, less traumatic, asphalt or, something to help, without any skin breaks, right? That would be a lot easier than playing in the junkyard where there's like sharp objects and maybe some infection, at risk of higher like infections that we can deal with. But I think that's the biggest thing that I often see a lot for my patients. It really depends on what is the immediate concern that that family or that patient has to deal with, right? Is it money? If it's money, then they are not going to be as focused on necessarily of, let me talk, let me think about what kind of foods I should really be focusing on, what I should be eating. Or even just, let me check my blood pressure and see what it is at this moment in time, because there's other things in terms of their priority that they're really focusing on. And I think it really boils down to also then medications. Like when you're coming to see the physician, you're coming, or even at the urgent care or doctor's office, some of my conversation with the patients are, well, this is too expensive, right? There is no way I am able to afford this much for just one medication, and you expect me to take 10 different medications. Like that's, I have bills to pay. I've got to feed my children. What can we do? So I think, it definitely hits the money. It definitely affects our health, and not just physically too, but mentally as well too. And I think that is all very much interconnected. So absolutely.
Thank you, Dr. Lynn and Dee, for really teeing us up on how heart health and the social determinants of health are connected. And really, Dee, one of the things I wanted to call out that you shared was equity of health and how it's disproportionate in communities of color. And when we think about, all the communities in Central Valley, when we look at health equity, access to healthcare, access to housing, access to accessible and affordable foods, we know again that the disparities exist. And so that takes me to our next question. So for Vilay and Kim, can you share from your lens both as a community member and working alongside community members through your respective organizations, how are communities of color affected by the social determinants of health? Kim, we'll start with you.
Thank you. As working for the Black Youth in Health program, I've heard many times from moms how living in their area, how it is unsafe, or how there is no green space. So having, like access to green space, safe areas in their neighborhood, or where they can't go out and play, or mom can go out and walk, or and living in an area where there is no grocery store. So they have to rely on the neighborhoods, or they live in neighborhoods that have multiple liquor stores. They don't have access to healthy foods. So they rely on family members if they don't have access to transportation to get there. It makes it very difficult for them to access these the things that they need to stay healthy or become healthy.
Thank you, Kim, for sharing that. And we know that in addition to a lot of issues around transportation and sometimes the rural nature of the Central Valley, it's also language barriers and age, because we know sometimes some individuals don't drive or maybe have stopped driving. So that is definitely some of the factors that we see. And so Vilay, can you please add from your perspective how communities of color are affected by the social determinants of health?
Yeah, absolutely. So I work with the Hmong community, with the Hmong New Year that happens here in Fresno, California. And what I have noticed is that health issues in our community are still kind of a taboo. It's not shared with anybody outside. It's kind of kept in the family. And so because it is taboo, we don't know how to help somebody if they don't reach out for help. One of the other issues that I've noticed is for a person of color is that our health issues are not in mainstream America. And so in mainstream America, if it was more discussed about in an area where they can see, they can hear about it, whether it's radio or TV, I think that they would start to reevaluate themselves, reevaluate what they eat, where they play, how they play, places that they can go. And so, since our issues are not in mainstream America, and it's a taboo, and we keep them to ourselves, I noticed that contributes to the social determinants of our health. It is only after somebody has fallen gravely ill that we start to find out, they had this going on in their system. And unfortunately, by that time, often we will see that it would be too late. And so that's one of the things that I've noticed in our community is just we need to get these words out there. We need to get health on the top of our list and get it out of the taboo. Talk about it openly.
Thank you, Vilay. And you just really shared some great insights there, because I think this conversation lends itself across different communities, right? So a lot of times we see that around mental health, that there's still a lot of stigma attached to that in all communities, whether it's, racial or ethnic, or through age, or through different, like the LGBTQ plus community is seeing an increase in health disparities around cardiovascular health. And so, like, how are we addressing that? And one of the things, we would love to hear from our audience in the chat box would be, what are some of the strategies or ideas that you have that we could address, really bringing mental and heart health well-being into our communities and having these conversations and not making them taboo, but just really part of our daily conversation. So if you have some ideas, please share them in the chat. We'd love to be able to, learn from you as well. So thank you, Vilay and Kim, for sharing these wonderful insights. Now the next question, because when we think about, again, building off of what Vilay was saying, which is heart health and health overall is taboo in a lot of communities around talking about it. We know that sometimes the other end of the spectrum is, I feel great. I'm healthy, my family's healthy, so why do I need to go to the doctor? And so the next question is for Selena and Dr. Lynn. So in that spirit of, I'm healthy, my family's relatively healthy, why is access to healthcare important if people are feeling healthy? So Selena, I'll turn that over to you to kick us off.
Sure. Thank you, Juliet. And you said it, right? Why, Selena, do I need to go and access healthcare, physical, mental health if I feel fine? And Vilay, it's in my family and culture as well. I think we see it across the board, but I think maintenance, right? Just like anything. So prevention and maintenance, and keep up that great mental health, the social and emotional as well, right, as well as physical health, so that we can continue to go on and care for our family and care for our community. Healthcare can also help address, as we mentioned earlier, social determinants of health. So housing, as indicated in the poll, food insecurity and meals, right? So it's not only addressing your internal physical health care and heart health, but ensuring that those other needs are met as well. So establishing a really good relationship with your doctor, with your provider. At Anthem, we call it, establishing that medical home and really having someone to go to. So if it's not your family, but maybe you get along well with a doctor or another provider type, and you say, I just want to go in for a checkup. That's what's important. Even if you're feeling healthy, because life happens, right? Things can change, situations change. And so keeping a really good maintenance schedule for yourself all the way around is key.
Thank you, Selena, for sharing that. And I echo what you're saying about, just getting that wellness check even annually. It's important, just like as we have a car, we maintain that car. And if you don't change the oil, as I found out with my first car, After his 90,000 miles, I didn't change the oil and the engine blew up, and there's some surprise there. But really that annual check is so critical. I will just share a quick caveat. For example, my husband, who is Chinese American, culturally, he grew up not believing that, you know, Western medicine was something or that he should prescribe to. And finally, last year, he got a wellness check after like 10 years, even though he was healthy as a horse, or so we thought. And then it turned out he had colon cancer. So just by getting that screening, we were able to detect it early and get him the care that he needs. So again, you know, screening, even though we know that we may be healthy physically from outlooks, having that maintenance and looking at your heart health, like your cholesterol numbers, your glucose numbers, your blood pressure numbers are all really important to making sure that we're on track to leading healthier, healthier lives. And so with that, Dr. Lynn, can you also provide some additional insights?
Yeah, absolutely. I completely echo what everyone else has said before. And really, I think it's just so important for prevention and maintenance, even if you are feeling healthy, because there are some things that you may not even pick up on or even realize are just actually early signs of something that, you know, you may not even notice, but then you go to the doctor's office and we're checking your weights or we're checking your blood pressure. And, you know, I have some of my patients, even as a side comment, right, when they're about to leave, say, oh, by the way, I also have this one little thing over here, but I'm sure it's nothing. And, you know, a lot of times I'll stop them and say, oh, let's hold on. Let's actually let's look at that a little bit more. So I think it is really important to be able to have access to healthcare, go to your doctor. And, you know, it's just another person to talk to make sure that everything is doing well, not just with our physical body, but also I think mentally, and also just making sure that we're making healthier choices too. So, a lot of times it's also just a reminder to say, hey, well, what are we doing? How active are we? Right? Are we walking? Are we trying to be more active? We're not just sitting in front of the computer working, trying to, make ends meet, and we're just neglecting our body. So I think it's just a reminder for us, and sometimes there's ideas that we come up with, right? Together, where we can look at your diet specifically or your exercise regimen and your lifestyle and say, well, what about this? What if we just add on 5 minutes to, X, Y, and Z? Or what if we're able to just do, switch around the timing of this, and we're able to, just even spend that 5 or 10 minutes for ourselves, right? Whether that's mentally, physically, whatever it is, I think it is very important to just take care of ourselves. I definitely would say, yeah, absolutely. You do need to, definitely recommend seeing a physician, seeing a doctor, or just having access to one, because you never know what will come up. And it's nice to already have that established relationship where they know you.
Thank you, Dr. Lynn. And we know that, part of this conversation includes, how do you access healthcare? And so we'll provide some resources from Anthem and some of our other organizations that we're working with to really be able to help our community members get connected to provider care. One of the things that you brought up, though, was the importance of physical activity. And we know that physical activity and diet are so critical in maintaining optimum cardiovascular health. And so with that in mind, Kim and Dee, can you please share, when you think about heart health, what are safe streets and why are they needed? So Kim, if you could maybe speak a little bit about what safe streets are and why are they needed, that would be great.
Okay. Safe streets are evenly paved, designated areas where people in the community are able to walk. So having that safe street area where they're able to, like I said, have walking, even if it's a walking trail, but it's not connected to the road. So where people are, the cars are on the road, the pedestrians are on the street walking, having dedicated crosswalks. So just in case they need to cross the street, it'll be in a safe way so that when communities have access to these things, hopefully they're more likely to get out and walk, increase their steps so they can become more heart healthy.
Thank you, Kim. And one of the things we know that a lot of our community-based organizations are looking at now that we're able to come out of meeting and shelter in place is walking groups. And so that's a really great way if, to your point, the streets are paved and it's safe for residents to get together, that, that's something very cost effective that we see happening as walking groups coming up again. So thank you for sharing that and that wonderful definition, because I know we hear it a lot, but sometimes people are like, well, what is that? So thank you for sharing that. And in that vein, Dee, can you share some tips about what we can do around increasing or improving or maintaining our physical activity, whether it's, coming back into in-person meetings, and as we gear up for summer, maybe things that we can do indoors while we're trying to beat the heat?
Yes, thank you, because I think it's deeper and broader on many spectrums, especially as you talk about safe areas. And Kim, that was a great definition. But I know even if I have an unpaved street, if I'm in a rural community, or I have to worry about, if there's any gangs, or if there is, maybe some miscellaneous behavior that I'm not feeling safe, because safety is on the, perception of the person. With that being said, if I don't feel safe to get out and walk in my community, it makes it very, very difficult to get out there and even feel motivated. And so I thank the person even for in the chat that talked about the mental health and stress connection as it, affects our heart health. A lot of times we don't even know what we need, right? As far as physical activity, as far as mental health. I know a lot of people within the BIPOC communities definitely may not understand mental health as it relates to mental health, right? It may come up somatically, it may come up in our physical. And so the beauty about physical activity is that it connects to the brain. And so I'm sure Dr. Lynn can definitely go there a lot more than I can, but just being in the field and my experience is that they talk to each other. I know sometimes we think the brain, the mind, and the body are separate, but they're interconnected. And so when we physically move, especially intentionally, not because you're running away from a bear or a gang or in a domestic violence situation, that would make you move, but under a high pretense of stress, right? And so if I do the intention because I want to take care of my heart, I choose to take care of my body, within the first 5 minutes of physical activity, you can start producing endorphins, which is the body's, free morphine, which makes us feel more relaxed and great. And it can help us even 20 minutes up to 12 hours pass, depending on how much you do and how often you do it. And so there are some indoor communities. For those who are watching in Kings County, there's Lemoore Recreation Center. They have an indoor track. They do have groups for those who are elderly. And just to allow some air conditioning, because it will be very hot this summer for all of us who are here in the Valley. And so I would imagine Kern County as well. And so we want to make sure that we're hydrating. We want to make sure we're moving, even if it's 30 minutes, 3 times a week. And you can split that up. You can do 10, 10, and 10. I always tell corporations that I work for, if you work an 8-hour day and you're able to move for 5 minutes each hour, you just sit 40 minutes. And so it doesn't need to be very structured. It could be just, lifting your arms. I do something called a WY. So you could just go like this to get some movement at your desk. Glutes are important. I know we laugh at that name sometimes, but it is the functional movement that we need in order to get out of our cars, use the restroom, go to bed, relax, and move about. And so when we think about physical activity, don't think about it as work, think about it just as moving. And so you can do that, find a YouTube, you can just walk around your apartment if you don't feel safe enough to go on those even uneven paved roads or paved roads. You know, some people go looking after unpaved roads. It's called hiking. I'm not a hiker, so I don't know, but I would tell you that there are some things that you can do, and it doesn't have to be that intense. And so remember, one of the best aspects of whole healthcare is physical movement, not only for your heart, but for your mind. And so hopefully that helps.
That does. Thank you, Dee. And so, would love to hear from the audience in the chat. When you look around your neighborhood, whether it's where you work or where you live, are you seeing safe streets? Are the streets paved, or is maybe there's some opportunity to work with your local city and county and making your safe street, having more safer streets, so that way you can get out and walk and safely and get some more exercise. And in that, also, because we've been together here for half an hour, I'm going to just go ahead and ask everybody to do a couple of quick stretches. I'm going to do some, so we just stretch a few and just kind of get a little bit of movement going. Thank you for that great reminder, Dee, because again, we get so into the moment of what we're doing that I think we forget that we have to move. It's so critical. So, and again, Luke, I appreciate what we've learned so far, and when we look at heart health, knowing physical activity is one critical component, but another critical component that we can also control is our diet. And so when we think about optimum heart health, having access to healthy, nutritious, and affordable foods where we live and work is important. And so for Vilay and Selena, I have a two-part question for you regarding nutrition security. So can you share a little bit how nutrition security affects one's heart health, and what are some of the factors that prevent individuals from accessing healthy and affordable foods? So Vilay, if you could go ahead and start, that would be great. Thank you.
Yeah, I was going to answer the second question first. What are some of the factors that prevent individuals from access? The word is prevent, and I was thinking, goodness, what can that be? Well, it is definitely the mindset. Junk food is just much cheaper. Junk food is much cheaper. It's faster. It's readily available. Earlier, Kim had said that in certain communities, liquor stores, there are more liquor stores than there are supermarkets, and therefore, if anything at the liquor store is pretty much junk food. And so it's the mindset, right? It's the mindset. How do you prevent access to healthy food? There are healthy foods, but they are expensive to the communities that are in need. And unfortunately, those are the folks that I see suffer the most as far as heart health condition and overall mental and stress level, all that. It happens in those communities. As far as nutrition security, you know what? I have learned through the years that, and watching my community, watching my family, watching my parents with heart concerns, it really is based on nutrition too. Well, not necessarily, I wouldn't say 100%, but there is, again, the factor of exercise. We do need to change our nutrition. We do need to learn about what can we do differently? What can we eat differently in place of certain foods like sugars? Sugars, I believe, are one of the main reasons that contribute to our heart health. And so so my overall assessment of this is definitely education. Let's educate our underdeveloped communities, our minorities, on what it is that has been contributing to our heart conditions and our overall mental state. And so I would leave it at that. I'd really love to hear what everybody else says too.
Thank you, Vilay. And I'd like to now turn it over to Celine to add her thoughts as well.
All right. Thank you, Juliet. Thank you, Vilay. Oh my goodness. Again, you said it, right? Fast food is so accessible, unfortunately. And It's you know, it's easy, it's convenient, but what we eat and the quantities, or you know, the serving sizes matter as well. And you know, so heart health definitely correlates with, you know, nutrition and lifestyle, as we were talking about earlier. We are starting to see, and especially with the beginning of this year, some great programs. And I'm thinking of the, you know, more vulnerable populations that we work with, those that have chronic health conditions, maybe chronic health conditions with some behavioral health needs as well. Those that maybe are homeless, right? I'm talking about our social determinants of health. One of the programs that Anthem has launched in January of this year, which is super exciting, is our meals and medically tailored meals program. So for our Medi-Cal members that are eligible, and this just goes right along with it, they'll have access to, and they have a choice, which is super cool, either home delivered meals. So, you know, talking about location and food deserts and, you know, access that helps alleviate that for the time being. Now it is there is a set time, right? So up to 12 weeks, an individual that qualifies can receive 2 meals a day for up to 12 weeks, and you know, possibly an extension after that. So something that's home delivered for them, that, you know, if all they have is a microwave, something that can be, you know, just quickly put into the microwave, warmed up, and it's ready to go. That are nutritious and that are the appropriate serving size as well, right? The other option that we're offering in the community, you know, here in the Central Valley, and I'm born and raised in the Central Valley myself. So the other option is a grocery voucher. So some of our, you know, families, some of, you know, moms, you know, I'm thinking of my culture, like, I don't want that, you know, delivered meal. I want to go grocery shopping myself. Good. So there's an option for that too. We can give you a grocery voucher and, you know, encourage you to go buy healthier food options as well, because cooking with healthy ingredients and learning to do that for your family is really, really important. So it's great to see and to know that there are programs and opportunities out there for our communities. It's just now, and Valet mentioned it, you know, earlier too, is educating and awareness and what can we access. And then after those programs, you know, because there's this start and stop time often for those, right? So education and learning about nutrition, so that it's a long-term, so that, you know, you're healthy and that you can maintain that health long-term is important. Thank you.
Thank you, Selena. And we know a lot of times, right, having access to food, and the program sounds wonderful. And I know there's also food pantries with a lot of faith-based organizations. A number of the universities have them on site. So just really being able to bring that to the community, but also one of the areas that we're seeing an improvement in as well is providing food that's culturally appropriate, that's also healthy. And so we know a lot of times that is something that there's work that needs to be continued done, especially like we're hearing in Central Valley, the need for more halal foods at food banks. And so really looking at how we can work together to help all of the communities that we're a part of. And taking us to the next question, Selena, also for you. When we think about the social determinants of health, and as Dee had kicked us off with that explanation and example, you know, why do things happen around heart health? Because, you know, there's like that whole chain of events where, you know, the little boy was in the yard playing, hurt himself. But why was this? And so as she went through that chain, she had mentioned access to education and access to employment. And so would love to just hear some more insights on what roles both education and employment play in heart health.
All right, thank you again, Juliet. Absolutely. Education can lead to more accurate health beliefs and knowledge, and really it's truly to learn about what's out there, right? It doesn't have to be a formalized education, go take a class. So that would be nice. But education, and employment can, I think, also help with an individual's mental health, right? And keeping that up. But as we become aware of programs and services and why it's important to do everything that we've already talked about, prevention and maintenance and going to get regular checks, and we can provide more for our families and for our communities. Education also increases opportunities for better employment, and higher income can potentially allow for a healthier diet. We mentioned earlier, eating those healthy foods can sometimes be expensive, right? And accessing those. And so as we gain some secure employment and steady employment, that increases the access as well. So I'm a believer in improving and advocating for yourself, as a mom, as a community member, understanding again what is out there, improving our health literacy, and for you and for those closest to you, and of course staying physically and mentally healthy. Both really go hand in hand. Education and employment can do those things, can be a really good positive contributing factor to those.
Thank you, Selena. And really, again, just reiterating the fact that, there is that direct correlation a lot of times between education and having that higher level of access to health insurance, which then helps you, be able to not have to have potentially high co-payments for services that might be needed, or a lot of times, like earlier, that was brought up around medication, whether it's, am I going to pay for my heart health or diabetes medication, or am I going to pay my rent? So really removing those barriers is so critical for heart health in our community. And when we think about other resources and services that are available for community members in building heart health, can I ask each panelist to go ahead and share what resources you would like our audience to know about, or services that are available for them and or patient or community populations that they work with. And so I'll ask Valet to start, and then Dr. Lynn, and then it'll be Kim, Dee, and Selena. So Valet, if I could kick that question over to you, that would be great.
Yeah, the resources that we can provide with the Hmong Culture New Year celebration is that during our event, we reach out to a lot of the nonprofits and other communities with that cater to the Asian community. And so we have a list of contact numbers, like the Hmong Nurses Association, like they are one of our counterparts. And so we have a list of people that you can go to when it comes to reaching out to them. And we can do that with the Asian community here in the Central Valley.
Thank you, Valet. We really appreciate learning about those resources. And so next, Kim, can you go ahead and share some of the resources that your organization provides, or resources, other ones that you would also like our community to know about?
Yes. The Fresno County Department of Public Health, we have the CalFresh Healthy Living Program. I know they do have targeted areas, but they do, especially rural, but they are also in Fresno, the Lowell area, West Fresno 93706, but that is also a program that can help individuals increase their access to healthy foods, increase their access to ways to be active, decreasing so they don't have to run to fast food places to get their nutrition.
Thank you, Kim. And Kim, a follow-up question for you. In terms of CalFresh enrollment, does your network also have enrollment specialists that speak different languages in case language is a barrier?
I know personally, our program does not. So we always refer any members who need other to speak other languages, to go to West Fresno Family Resource Center. I know they have different Spanish speaking that will help them apply for CalFresh and even Medi-Cal.
Thank you for sharing that. And I see here also in the chat, we have Renee Cifuentes from the Fresno County Department of Health CalFresh Living Program. So Renee, if you could maybe just drop in the chat as well, where we can also share a resource with additional with the audience as part of our follow-up, that would be great as well. So we have that resource. So thank you, Kim. Dr. Lynn, would you like to go next?
Yeah, so with the UCSF Fresno group, we do have, and I can put it in the chat, but there is a, what we call like a UCSF mobile heal. It's basically a mobile clinic that the purpose is to kind of help out for the community, provide kind of like no cost medical care, whether it's like screening, you know, basic screening tools and whatnot. And we can kind of help you, right, you know, get the follow-up that you may require and kind of use that transitions. So I can put that into the chat, but that is certainly something that we have to offer. The other thing too is typically, and you know, we will also kind of create what we call a continuous medical education or kind of symposiums, really similar to, I think, this webinar. And it's, you know, out for the community. Those kind of come in sporadically, but almost every February, because of the kind of heart month that February is, we do have some kind of community event as well too. That while not, you know, I wouldn't have the information for that right now, but I would just say can be on the lookout for it. Again, it would be also with UCSF Fresno, and that one is specifically mostly, you know, talking about heart health and really like what are ways that we can do to try to help, you know, maintain, prevent, or even help treat kind of our health in our body that way. So I'll put at least the mobile heal or that mobile clinic information into the chat for us.
Thank you, Dr. Lynn. And really speaking about meeting communities where they are literally with the mobile unit is so critical, and helping start with that screening and then the sustainability change, right? The referral, whether it's to a private healthcare system or to a local FQHC like Clinica Sierra Vista or Omni. And so with that, Dee, can you please also share some resources for our community members that they can utilize?
So I believe we already put 211 Kings County in the chat, and that is just like a one-stop shop for folks, whether it's housing, transportation, food, access to care, information. For myself, finding inner transformation, I tried to go up the ranks with corporations and organizations. So I host a lot of seminars and trainings on what is wellness, how trauma-informed care is bigger than just the person who experienced trauma. We talk about epigenetics. We talk everywhere from intergenerational trauma to diversity and inclusion and how that impacts us. I love Renee's questions in there because that's essentially what I do. You know, how does culture impact our stress level? How does stress impact our culture and mental wellness? So I look at the folks who can have the pen a little bit and make some changes within their organizations to be more friendly to different communities. And so I will put my YouTube channel in the chat. That's where I just give free information on all things health, whether it's mental health, whether it's physical health, spiritual health. So that's one. And then the other is I'm contracted with a couple of early Head Start education programs within this county where I host parent meetings. So I talk to the parents. And I don't necessarily meet them where they are. I take them where they want to go. And that's the bridge for me, you know, is helping us do the work together to get to, because they're the expert of their life, right? So if they're the expert of their life, then I come from that framework, and then expand it, right? Expand the container a little bit. So I will put my information, my YouTube and my website if you're interested in corporate wellness trainings. Absolutely. If you're looking for parent groups and you are from some of these more diverse or rural areas, we can definitely get you connected to where those are hosted at. Thank you.
Thank you, Dee. And I love it that you're taking to more they want to go. So that's such a great mantra, I think, for all of us when we think about, even though we might be dealing with barriers and social determinants of health ourselves, it doesn't mean that we have to stay in that situation, and that we can work together with individuals such as yourself or other different community-based organizations or healthcare systems, to providers, to really move forward and get to that destination that is a place of optimal heart health. And so thank you again for those insights. And Selena, can you share some community resources for our audience as well, please?
Sure. Yes, this is exciting. So thank you, Juliet, for allowing me to speak on some of the programs that Anthem Blue Cross Medi-Cal is offering right now. A huge one is CalAIM, California Advancing and Innovating Medi-Cal. So this program was designed to support our individuals, our members with social determinants of health needs, as well as physical health needs such as heart health. And so a little bit ago, I mentioned our medically tailored meals program, which can support, individuals with healthy food and ensuring that they have access to healthy food. Also, our members that may be, at risk for homelessness, or those who are homeless and have a heart condition as well. We can connect them with a provider who is a local, often community-based organization to assist them with housing navigation, right? So helping them to identify or to secure permanent housing. And if that member needs help with first month's rent or security deposit, we can connect them, with those services as well. And then, if an individual has been homeless for a little bit, they may need to learn, some skills and housing tenancy. So a housing tenancy provider, a community-based organization would help that member in, learning how to build a relationship and maintain a relationship with their landlord, for example, how to find some meaningful employment, lots of really, really good services. And I can share that link if it's not already shared with you in the chat box, but a couple of other services really quick before I hand the baton back over to you, Juliet. Asthma remediation and home modifications as well. So an individual that has a heart condition or another type of physical medical condition, once they're in a home and maybe they need a ramp to get them in, to assist them with getting into their home, bathroom widening, or even just air filters, for example, and asthma remediation. We are contracting and working with local community-based organizations, the non-traditional providers, right, to assist our members in accessing all of those services. So really taking a look at social determinants of health and integrating those with the members' healthcare needs as well.
Thank you so much, Selena, for all of those great resources. And, when we think about just the development of communities and the needs that there are, a lot of times too, for individuals that might be looking for example, career development, that a lot of the community colleges have returning back to college for adults. So, that kind of want to use back into maybe a different career or continue to build their career journey. And then in terms of looking at transitional housing that you mentioned, also great programs by CityServe that covers the greater Central Valley, as well as Catholic Charities. So just thank you again for all of those resources. And I just want to thank all of the panelists for the great conversation and for providing those resources for us to share and benefit from. And so now I'm going to go ahead and spend a few minutes just seeing if there are any questions from the audience for our panelists. Selena, one question that came up for you was is the food distribution program that you're doing, the meal distribution, tied with or affiliated with Meals on Wheels?
In some communities, it is affiliated, but we are also partnering with other organizations that are offering meals and medically tailored meals programs as well. So it is, and as well as other organizations too.
Thank you for sharing that. Dee, for you, question that came up is, can you share just a little bit more about how mental stress correlates to heart health?
Well, yeah, I think maybe Dr. Lynn can piggyback on this. We know one of the #1 ER visits is for stress-related ailments. And so again, when we talk about folks who may not be attuned with their bodies, especially it's going to come up somatically, right? So it may be a stomach ache, it may be a headache, it may be tension in their neck. They think they're having a heart attack, but it's a panic attack. So when we talk about those things, I mean, we don't even have enough time to even cover it, but they are directly connected, and too much chronic stress can lead to other health issues of the heart. And so with that being said, I don't think there's enough time to totally talk about it in the context and the time frame that it really needs. However, we have to think about there are some folks that may not even see it as stress. And if you are living in some of these social determinants areas, then stress is your first name. It's your priority. You may not even be able to connect that it is stress. Matter of fact, you may not even know that you need what relaxation means because you're hypervigilant or have other behaviors that just kind of keeps that stress level very high. So with that being said, I'll shoot it up to Dr. Lynn more specifically.
Yeah, I mean, I think one of the most common things I see with stress, exactly, it can manifest itself in so many different ways. But I think most commonly and directly, stress or just, frustrations, whatever it is, affects our blood pressure first and foremost. And I think if you're constantly in an environment where you are constantly worrying or in that very high stress environment, your blood pressure will consistently be elevated. And then that over time is then gonna, your heart's actually gonna remodel because of the changes that it's having to deal with. And so you can start getting heart failure, you can start getting strokes, you can get heart attacks. So it becomes not just a somatic kind of reaction to, hey, just stress and psychological or mental health, but it really does start, your body is so adept at trying to control the environment that it's being presented, that it will make those changes, whether to try to adapt, but then ultimately it's going to manifest itself in terms of like strokes, all these other organic diseases that are real. And so you just really want to be able to kind of help manage that or hopefully prevent that before it gets to that level.
Thank you, Dr. Lynn and Dee. And Selena and Valet, and Kim, there was an additional question that I'll email out to you about maternal health programs. So I'll get that over to you. But again, thank you again, everybody, for joining us today. We did have resources up, so we'll also provide that as well, that you can share in your communities and also utilize. And I'll turn it over to Kim Berry, Executive Director, to end our call.
Thank you everyone so much for joining today. And thank you to our panelists for sharing all that information. It was a lot of information. So hopefully you guys can find it all helpful. After the webinar, you'll receive an email with a recording of the program also, and the resources from Anthem and the American Heart Association. So thank you so much again for attending today, and I hope you all stay well.